Hello ladies and gentlemen, and welcome. Thank you very much for joining us. I'm Dr. Derek De Silva. I am the chairman of the planning committee here at AMMG. We are here in Las Vegas at the Bellagio, November 2015, and it's a pleasure to have with me Dr. Ernst Schaefer from Massachusetts. Tell me a little bit about you. Where are you working? What are you doing?
Right. So I've been involved in heart disease prevention since about 1972. First, I did my training at Mount Sinai, then I was at the National Institutes of Health, and since then I've been at the Tufts University School of Medicine. And in 2007, I founded a lab called Boston Heart Diagnostics.
Okay. So, tell me, cholesterol, one of the hottest, probably one of the most controversial topics today.
Yeah.
What's your take on cholesterol?
Well, I think clearly we know that studies have shown on the face of the planet, the populations that have a lot of heart disease are the populations that are eating a lot of animal fat and eating a lot of sugar and leading a sedentary lifestyle, those people. And then we also know that the major risk factors are aging, high blood pressure, high LDL cholesterol, low HDL, diabetes, smoking, and high blood pressure. I think I mentioned that. So those are the major risk factors, and we do have a good risk algorithm through the American Heart Association.
So do you believe that cholesterol is a risk factor for heart disease?
There's no question about it. A high LDL cholesterol, a high small dense LDL cholesterol is a risk factor for heart disease, along with elevated levels of a genetically determined particle known as lipoprotein A. And we also know that low levels of HDL are a risk factor for heart disease.
So what about inflammation?
Inflammation is very important, but the question is what starts the inflammation? The inflammation is really the lipid and the cholesterol that's in the liver and in the artery wall. That's what causes the white blood cells to migrate in and create inflammation in the artery wall.
Your solution?
Well, for younger people whose risk is low, the solution is diet and exercise. A lifestyle where we restrict the amount of animal fat, more fruits and grains and vegetables, exercise as much as possible. And in the older people, if their risk is high enough, or if they have a positive calcium score, or if they have heart disease, then yeah, we would use statins to try to optimize the LDL cholesterol.
How do you explain the fact that there are people that statistically, about 60% of people that have heart attacks have normal cholesterol.
Well, they have an imbalance. When we've studied this extensively, both in the Farmingham heart study, they don't really have, they have fairly normal LDL, but their small dense LDL cholesterol is elevated. They'll often have low HDL, so they'll have an imbalance in the way the particles are carried. And of course, cholesterol is not the only predictor.
And I think that, in my mind, in my opinion, that's really the key. The key being, it isn't just looking at your total cholesterol, looking at your total LDL, your total HDL. It's really getting to the next level of particle size.
Yeah. So in the risk algorithms, like from the American Heart, they use total cholesterol and HDL. So then they actually calculate the non-HDL, which is contains all the atherogenic particles. But measuring them directly is a better way to go.
Triglycerides? Your take on triglycerides?
Triglycerides are important. Most people with high triglycerides have low HDL, have insulin resistance, or are prone to developing diabetes, so triglycerides are very important.
And your take on homocysteine?
So homocysteine has been a little bit maligned. It's a very important risk factor, and we know that you can lower it with folate, B6, and B12. It turns out that it's less of a risk factor for clear-cut atherosclerosis and more a risk factor for clotting and for strokes. And we now have two studies, the HOPE-2 trial and a big trial just published out of China, that lowering homocysteine with folate reduces the risk of stroke significantly.
I had the pleasure of interviewing Dr. Killian McCauley many years ago in Orlando.
I know him. I know
wonderful
him.
Gentleman.
Wonderful man.
And
he was the first to describe hyperhomocystinuria, hyperhomocystinemia. Yeah.
Right. And it's, the information that I remember him giving me was just absolutely remarkable. So, well, we thank you for your time. Thank you very much for joining us.
I just want to tell you one other thing.
Sure.
With statins, there's a lot of people get muscle problems. We know some of the things that cause that. And giving people CoQ10 is a good thing. There's a genetic variant that where people don't take up statins. And you don't have to use high-dose statins. Use low doses of water-soluble statins, and they help. Fish oil helps. We know those things help. And there are other agents that help in heart disease prevention for the people who have disease.
Absolutely.
So I'll just stop there. Thank you.
Very good. No, I thank you very much
okay.
for joining us. Stay right there. Stay right here. We just want to say thank you, everybody, for joining us.
Yeah, thank you.
Folks, it's been a pleasure. Thank you very much for spending some time with us today. I'm Dr. Derek.